Athletics has sponsored Go Pink with the Dragons for the past 5 years. The purpose of the event has always been to raise awareness of the importance of screening and early detection of breast cancer and other cancers. During this week, we also raise money for Roger Maris Cancer Center, which is located in Fargo. We do this by selling t-shirts, pancake tickets, holding a silent auction at the basketball game, and engaging other community members, such as the FM Derby Girls, to partner with us to bring awareness and raise money for cancer research. We are also excited to announce that part of the proceeds will fund the Go Pink with the Dragons Scholarship, which we hope to award next academic year to 2 MSUM students who have been directly affected by this disease. You might ask, why does Dragon Athletics sponsor this event? The reason is because the Women's Basketball Coaches Association, otherwise known as the WBCA, holds a nationwide initiative in which they ask basketball programs to sponsor a breast cancer awareness game and to donate any funds raised to either the Kay Yao Cancer Fund or to a cancer fund of our choice. In addition, the NCAA also has part of the Life in the Balance for our student athletes, a community engagement component. Through the Go Pink event, we hope to educate, raise money for our local cancer center, and engage our community to make a difference. At this time, on behalf of Dragon Athletics, I'm excited and honored to welcome our guest speaker and members of the panel. Dr. Shelby Terpstra is a medical oncologist at Sanford Health and is a medical director of Embrace, which is Sanford's Cancer Survivorship Program. She is a Mayo Clinic trained physician and was involved in research and training at Spark, which is Mayo's innovation lab. In 2011, she was awarded the American Cancer Society's Lane Adams Quality of Life Award, a very prestigious award given only to 11 extraordinary and compassionate caregivers annually. Please welcome Dr. Shelby Terpstra.
Well, thanks. First, I want to thank your teachers for giving you guys extra credit for attending. And then second, I want to thank MSUM for this whole event. I think it's just really amazing. And also the fact that they raise money for a local cancer center, which is just so important because that money funds things that would not otherwise get funded. So it allows for us to have things like research programs, navigators, cancer survivorship programs, things that really separate our cancer center from other cancer centers and allow for the patient experience to be the best that it can be. So we really thank you for that, and we thank you for all of your support. So tonight, we really wanted to focus in on what does it feel like to have breast cancer, how does it get diagnosed, and what are some of the things that you may not have thought about with breast cancer. And we also think that it kind of extends on to other cancers and how you can take an active role in your health and wellness to prevent cancer and other diseases. And so today we thought that we'd bring 4 MSUM alumni, all of who have been diagnosed with cancer, and breast cancer in particular. And we hope to, by having them share their stories, really give you a sense of what this is all about. So, the stats. So 1 in 3, this is my only stat that I'm going to give you today. 1 in 8 breast cancer, or people are diagnosed with breast cancer, but 1 in 3 people will get cancer in their lifetime. So if you think it's not a disease that affects you, it's going to affect you in some way, whether it's a family member, or a friend, or a co-worker. You will know somebody who has had cancer in their lifetime. So we hope that you can get some tools today from this talk. So what I want to focus today on is how cancer forms. We want to talk about detection and some of the myths about detection and some of the tricks about detection. And then we want to look at an insight into the journey, and that's where these women will come into play. And then how you might support someone who has been diagnosed with cancer, and then how we might live differently to help prevent cancer in the future. So the first thing we think about with how cancer forms is genetics. And over 90% of cancers have some genetic abnormality. And only 5 to 10% of those are inherited. So the other genetics are things that happen along our life. We're exposed to certain chemicals that make our DNA get damaged. We age and we can get some DNA damage from that. Or just, we don't know why we get DNA damage. And what happens when we get DNA damage is that we lose our ability to control our cell repair. So cells start repairing and kind of keep repairing and don't have our natural stop mechanism. And so that's when you get a tumor. The other thing that comes into play is the immune system. This is a natural killer cell, one of the blood cells in our body, and they float around all throughout our blood system. And this one is attacking the green thing, which is a tumor. And they are doing that all the time. They're attacking tumor cells throughout our blood, they're attacking viruses and parasites and any other infections. Well, when our immune system is damaged from multiple reasons, some of them include immune deficiencies, AIDS, also immunosuppressant agents that we have people on for after they've had transplants and things, they have a tendency to get cancer. The third factor is inflammation. So when you injure yourself, you have a whole system that helps to repair yourself. And what happens is the blood cells, which are the bottom cells, they come to play first and they secrete some hormones, and that attracts the white cells. Then the white cells secrete some hormones, those are the purple cells, and that tells your tissue to repair itself. Well, it also tells any cancer cells that may be sitting dormant there to grow and grow unchecked. So in a state of high inflammation, we can have cancer cells that form unchecked. So in a breast cancer, you get, when any of these factors kind of work in concert together, you can develop a tumor. So you know the main risk factors for breast cancer, I'm sure you've heard of them. Of course, gender, we see a lot more breast cancer in women, although men aren't excluded completely. Family history and age. But that's not the whole story. You know, they're not the only things that contribute to getting cancer. And so just because you don't fit into this little category doesn't mean you can't think of breast cancer. So detection, we typically detect breast cancer by mammograms, and that's what screening mammograms is all about. We recommend starting mammogram screening at age 40 and doing this yearly. And what we hope to find is calcifications, and I'm just going to walk over here. These are the kind of normal calcifications, but then when you get a linear kind of calcification that lines up like that, that's often indicative of the very earliest type of breast cancer, which is ductal carcinoma in situ. And that's how we hope to find breast cancer, the very earliest stages. And you can see the dark spot there is when it's become a malignant lump. And it's really bright there, and it's not always that obvious. But then you can see the abnormal calcifications along there as well. We see breast cancer in people who are younger than 40. And so they often come because of feeling a lump themselves. And also people over 40 can feel lumps themselves too. But this group under 40 is particularly, it's more important for them to be screening themselves through exam because it's so difficult to see a breast tumor on mammogram in that age. And so this is a little demonstration of a breast self-exam. So we recommend doing this on a monthly basis, raising your arm, and doing it in a pattern, one of the 3 patterns on the edge or on the bottom, a circular pattern or a stripe pattern or a wedge pattern. And just doing it consistently like that every month. And so for the first story, we're going to have Abby talk to us about her diagnosis and her journey.
Hi everyone. I graduated from MSU in '95, Go Dragons. I was diagnosed with stage 2B breast cancer at age 35. And I'm now 39. Celebrated 4 years actually last Wednesday, January 25th. I found my lump. It was in my left breast, and I actually had doctored with it for a while. So, and of course, you know, cancer wasn't the first thing that crossed my mind either. So I was always very lumpy, and both breasts were just very lumpy, and I actually had a mammogram the year before I was diagnosed because I was so lumpy. So, and they did ultrasounds on me a lot as well. So finally, it just kept, you kind of know when something's not right, and I'm like, you know what, whatever it is, I want it looked at again. So it was biopsied and it was cancer. I had a double mastectomy. I did chemo for 4 months, and I also did radiation for 5 weeks, and I'm on tamoxifen for 5 years. And then I also did reconstructive surgery as well. So the one thing I can stress is to know your body and to do self-exams.
Thanks. So you may wonder, why do we not do mammograms on everybody? I mean, age 20, 30. And it really comes down to breast density. So the younger that you are, the more dense your breasts are. So it's very difficult to see the abnormalities like you were seeing on the other slides in a young person with dense breasts. And so this is kind of what it looks like on a mammogram. You can see that you can hardly see anything different. So I wanted Janelle to tell her story next.
Hello, my name is Janelle Meyer, and I graduated from MSUM in 2004. And I was diagnosed with breast cancer at the age of 27. It was just over 2 years ago. So I felt the lump myself, and I kind of, didn't really think anything of it. I just thought there's no way that it could be cancer. So I kind of watched it for quite a while, and when I did go into the doctor, she told me that it was nothing that I needed to worry about. So just, I wanted to trust that she knew what she was talking about, and that, I just wanted to trust that everything was okay. So I waited 9 months before going in again, and then at that time, they decided to do an ultrasound. And the radiologist said that we could do a biopsy, but he suggested waiting 6 more months. And I kept questioning him, wondering if, why we wouldn't do the biopsy right away. And finally he told me that if I were 40, he would definitely have done a biopsy. So as soon as I heard that, I just told him that I wanted the biopsy right away. So I had the biopsy, and he called me the next day and told me it was cancer. So from there, I went through 4 months of chemo. I had surgery, and then radiation, 2 months of radiation, and every 3 weeks I had IV treatments, and I just finished that last Wednesday as well. So, and then I'm on tamoxifen, which is an oral pill for the next 5 years. So I have like 3 years left of that. And I guess just the point about the mammogram. One thing, I didn't have a mammogram until after I was diagnosed, but when they did do a mammogram, they could not see the cancer even after they knew right where it was. And so it's just kind of like that picture up there where everything's white. One thing that I did before I started chemo was my husband and I were ready to start a family when I was diagnosed. We don't have any kids yet, and so what I did before I started chemo, I saved some eggs, like went through fertility treatment, so that because chemo can affect your fertility. So that was something that I just really made sure to talk to my doctors about before I started my chemotherapy.
Okay, so one of the things that we are trying to do to get better imaging with mammograms is switching from a film technique, which is the one on the far end, to a digital technique. And so when you see the digital mammograms, you can see much more finer detail. So they're a lot better for people who have denser breasts. The other thing that Janelle touched on is the ultrasound, and we really use ultrasound and mammogram in concert together. So if somebody feels a lump or a doctor feels a lump, doing a mammogram and saying it's okay is not enough. You have to do a mammogram and an ultrasound to really be very, sure that there's nothing there. And sometimes in those cases we'll often do an MRI as well. So, and then also in people who have really dense breasts, after they're to an age, 40s, 50s, we are considering other options for screening, like whole breast ultrasound or MRIs. So those are other options for detection. The other places we can see breast cancer show up is in the armpit. And the reason why we can feel lumps in the armpit is that it's the first place that the breast cancer will typically spread to, is the lymph nodes in the armpit. And so a lymph node that's enlarged in the armpit over a centimeter is not normal. And so that deserves follow-up with your doctor. The other way we can see breast cancer show up is a puckering or a dimpling of the skin of the breast tissue. And one of those first pictures that we showed of the breast shows those the fibers or the lobules and the ducts in those kind of strings. And when you have a tumor there, that kind of pulls back on those strings, and then that's how you get the dimpling. So this is a definite reason to go see your doctor.
Hi, I'm Stephanie. I got my master's from MSUM a few years ago. I don't remember the exact year, and I think that's from chemo brain, but I'm happy to be here. I was diagnosed at age 43. I had gone in for my regular annual mammogram in August of 2008, and although they sent me a letter saying it was normal, they flagged me for 6 months to come back in for a recheck. So I went back in February and got my letter that everything was normal. I was fine. Well, in June, I started to notice the dimpling that you just saw in the picture. That wasn't me, though. But whenever I would raise my arm, I noticed the puckering of the skin. And I waited around for several weeks and didn't go in because I had that normal mammogram in February. So I probably waited maybe 5 or 6 weeks before I just knew I had to go in. And then things moved rather quickly from there. I had a mastectomy, 4 months of chemo, 5 weeks of radiation, and I'm on tamoxifen as well, 5 years.
This is more of a graphic picture, and this is called Paget's disease, and this is a cancer that arises at the nipple. Areola complex. So it kind of starts off as a sloughing of the skin, and then this is kind of more advanced where it's really sloughing off and red. But if there's an area that's not healing in the nipple areolar complex, that deserves a check from the doctor as well. And then we also see breast cancer that has spread to other organs, the bones, the liver, the lung, and we can see the first indication of the breast cancer arising because they develop back pain or something like that, and then we go searching for the cause and we find that it originated in the breast. And then, unfortunately, Val couldn't be here today. She had strep throat. But Val was diagnosed with stage 4 breast cancer at the age of 34, I think. And she also had a lump that her OBGYN kept telling her that it's normal to have lumps when you're young, and so that it can't be cancer. And eventually she got referred to the breast clinic, and it was biopsied, and then further studies showed that it was metastasized to her bone. She's had 4 months of chemotherapy and then a year of directed therapy called Herceptin that goes right to an abnormal gene that we find in breast cancer. And she's also on tamoxifen and has been in remission since that time. So she's been very lucky so far. So that's great. But it can also start in other places, and just because you're young and you have a mass in your breast doesn't mean that it can't be of concern. On the far corner, we see nipple retraction, and that's also the same mechanism as we see with the puckering. It's the pulling of the lobules and ducts. And then the other picture is something called inflammatory breast cancer. And this is a rare, very aggressive breast cancer that starts suddenly and comes on quickly and can often be mistaken as infection because cellulitis or infection of the skin looks very similar. And so often they're treated with antibiotics and they don't get better, and they're treated with more antibiotics and they don't get better, and finally somebody thinks of inflammatory breast cancer. So I wanted Pam to tell her story.
Thank you. I'm so pleased to be here. I also attended Moore State back in 1984 through 1986. I was diagnosed with inflammatory breast cancer at the age of 40. I was diagnosed stage 3. I dealt with a infection in my arm, and it didn't go away, and I, like Shelby mentioned, was put on an antibiotic. And after about 8 weeks on an antibiotic, nothing got better. So I went into my doctor, and because of my age, they didn't really detect I think it was cancer, but they wanted me to have a mammogram and some further testing. And after I completed my mammogram, they did show some calcifications. So I had a biopsy, and I was actually misdiagnosed, and they told me I had ductal carcinoma. And after a lot of research on my own, I decided that I just didn't feel comfortable with that diagnosis. So I transferred up to Roger Maris. I'm originally from Moorhead, but now currently live in Breckenridge, Minnesota. So after I got that diagnosis, I decided to go to Roger Maris, and my doctor was suspicious of my symptoms, so we had a skin biopsy, and it was confirmed that I had inflammatory breast cancer. I had 4 months of chemotherapy, and then I had a double mastectomy with the removal of all my lymph nodes, 19 of them total. And when they were removed, they found that all 19 of them still had cancer. So at that time, my doctor just really didn't know what to do because of the rareness of inflammatory. So Roger Maris partnered with myself, and we got a referral to MD Anderson Cancer Center down in Texas. So I moved there for 3 months, where I completed 3 months of oral chemotherapy and 31 radiation treatment. And then came back, and I continue to go to MD Anderson every 6 months for a follow-up. And I currently just I'm a 5-year survivor. So I'm very proud of that. So basically, know your bodies, and don't be afraid to get a second opinion, because if I wouldn't have gotten a second opinion, I wouldn't be here speaking. So thank you.
Okay, now another question that comes up a lot of times with me and patients are the silly things that people say to them after they've been diagnosed with cancer. So we thought we'd take the opportunity to get advice from people who've had cancer about what not to say to somebody who's been diagnosed with cancer. Al?
I think one of the biggest things that I found was I saw a lot of my friends shy away because they used the excuse that they didn't know what to say. And it's okay to tell the person that you care about, you know, I don't know what you're going through, I don't know what to say, but just know that I'm thinking about you and I'm here whenever, however.
One thing that was hard for me to hear was people would say, well, at least you caught it early. You shouldn't have anything to worry, or as if I shouldn't have anything to worry about. I felt like they were kind of minimizing the seriousness of the situation. Didn't really understand that it's, you know, something I'll think about almost every day for the rest of my life.
For me, it was really hard for people who told me that I'm so young. I know when I went into the Roger Maris clinic, a lot of times I just didn't want to talk to anyone in the waiting room because they'd all kind of just look at me and say, "You're too young." And I guess, you know, you see kids going in there for treatments too, and it can happen to anyone. And another thing that I just thought of right now was the stories of people would come up to, I think all of us have had this before, where they'll tell us stories about their aunt or cousin or somebody who had died of cancer. I mean, it's just something that, like, for us, it's kind of hard to hear that.
I'll kind of speak for Val too, but Val would hear as well. Well, at least you had the good kind. And then for me too, it was, you know, people being specific about body changes, asking personal questions, stuff like that. Because I had reconstruction, so, and just to let everyone know too, it didn't run in my family, but I got that as a lot as well. What must have ran in your family? No, it didn't.
So you guys did a good job about my review of what not to say. This was a blog from Mary Williams, who is a stage 4 melanoma cancer survivor, and I thought it was the best. If you want to read her blog, it was really informative, and she goes into detail about all these things. But do not disappear, I mean, is the #1 thing. It's a fine line between curiosity and finger pointing. So things like, well, did you smoke? Did you not eat healthy or exercise? Or did you not get your mammograms? I mean, that's stuff not to say. And I think people do it mainly because they want to make themselves feel better, like, well, I'm doing all those things, so hopefully I won't get cancer. Don't tell them how to fix it, because ultimately you're not their doctor and their care team, and you probably don't know how to fix it. Don't be hasty with the best case scenario, so saying, well, it'll be okay, or this isn't the bad kind, because we don't really know. I mean, we don't, unfortunately, with this disease or any other kind of serious illness, we don't know what's in store. But don't be a downer either. So don't be Pollyanna, but don't be a downer and telling them all of the horror stories you've ever heard about cancer. Be useful and be guided by the person's cues. So what should we say to cancer survivors?
If I was going to meet someone today that had cancer, I think that the biggest thing that I would tell them is just take one day at a time. If you look at your cancer diagnosis and you're put together with the whole treatment plan, it's so overwhelming. So I just learned to just take basically one treatment at a time, and once I passed that hurdle, I just moved forward, and you know, it's amazing when you look back, and 5 years ago I can barely remember. So it's just one day at a time, and you'll get through it.
Since I've been diagnosed and I met all these wonderful ladies at my support group, I've met a lot of people that have cancer. My dad has stage 4 kidney cancer. My brother passed away from stage 4 kidney cancer in September. And my biggest advice to everybody is to ask for what you need. That's what I told my brother, and we would tell his friends what he needed from them, because people really do want to help, and we know that. But sometimes I think it's just really to be specific. Ask for what would help you out.
That was one thing, same thing with me. I just had to learn how to accept help and just know that people want to be there for you. So just let them do whatever they can for you. Another thing is just to keep humor, just keep staying positive. And for me, a big thing was journaling. It really helped me to get through the tough days.
A couple of the gals in our support group always say this too. They're always like, don't time travel, don't time travel. Live each day and take it one day at a time. Because when you first get diagnosed, I would remember, I think I got my license picture taken, and I looked at the date when I would have to renew it, and I did. I thought to myself, I wonder if I'll be here to renew it. And I was.
And I just want to add one more. I think one of the things, and I told all my friends, is don't ask me, how are you doing? Ask me how I'm feeling. It's an open-ended question. How are you doing? Well, quite frankly, when you're going through cancer, you're not doing really good. So I would ask my friend, just say, how are you feeling? And it was an open-ended. I could say, great. Or I could say, I just don't feel real good. And it was just, you got as much or as little conversation from it. So I think that's a way you can approach someone, and just say, hey, how are you feeling? And I think that works well.
Touched on this a little bit. Maybe you guys have more words about this, how we can support other people who are going through this experience. And why don't you guys you want to touch on your support group too? I have that later, but we'll just touch on it now.
One of the things that I found was going through cancer is I had a great support system, but really nobody knew exactly what I was going through. So, to find someone and partner with that person or find a friendship that maybe someone that has had cancer really helped me out. I actually reunited with a classmate of mine, and both together we realized that there really wasn't a lot out there. So that's where all of these ladies and we met, was through a support group, FM Breast Friends, that I started in 2008 because of the fact there just wasn't a lot of help or support for people going through that. So I'm proud of the group, and I think we're making a difference, but I just think that there's so much you can do for a cancer survivor. And I say that because you are a survivor the day you're diagnosed. And one of that things is you can send a card or make a meal. And I'll let the other ladies share, but I think just offering that support is just, there's just so much you can do.
I think for me, humor is a huge thing. I love to laugh, and my friends know that. So we had a lot of fun during this journey too. I used to joke about myself being dressed up as breast cancer Barbie when I went to my chemo treatments, because I had my pink jacket on, my pink earrings, my pink everything, my pink shoes. And one day my girlfriend showed up while I was getting chemo with a Barbie, and so we had breast cancer Barbie. And she's got outfits now, and my friend made things for her, and so humor for me was huge.
For me, just the support that I got through I had a website that I wrote, journaled on. I know a lot of people have Caring Bridge sites, and if you just write a note on there, just, even if you don't know what to say, just to say, I'm thinking of you, keep it short, just to know that people are there for you. Another thing is just to celebrate milestones with them, like if they are going through their last chemo treatment, or if they hit their 2-year mark or anything like that, just celebrate those things with them.
And also too, a lot of times, and I find myself doing this too, is asking someone, what can I do for you? Don't say that, just do it. Just bring that meal over, offer to drive them to chemo that day. I mean, just do it. Just like Nike, just do it.
And of course, we have awesome support throughout the community with Bras on Broadway, these types of events. So supporting those events always shows support for the people who are going through this journey. I know with these things, I often hear in the exam room that, I went to that game and everybody was wearing pink, and they felt different. I mean, they felt like I saw other survivors, I knew that I could get through this. People drive by Bras on Broadway and they see the bras and they realize that they can laugh, and they're on their way to chemo, and it just makes a difference. So all that stuff, supporting these type of events, it really makes a difference to the people who are going through it. There's a picture of their support group. And then we touched on Embrace a little bit at the beginning, but we recognize too that they're in the cancer arena at Roger Maris, that there is a definite need for education and support and connecting people to resources like the support group, like Live Strong at the YMCA. And we really wanted to be a hub where we could refer people to the necessary resources that are in the community, and also provide a lot of education about the long-lasting effects of cancer and its therapy, and things like neuropathy, infertility, hot flashes, sexuality changes. So we really work hard to try to bring those services, and these kind of events and support goes directly to supporting that. So thank you. So how has your cancer shaped your life, beliefs, and attitudes about the future?
As I said before, I don't sweat the small stuff. Every day is a gift to myself and to all of you. So, we're all going through, everybody's going to have something they're going to go through. But, you're going to get through it, and you just can't, the minimal things in your life, you just can't sweat, because it's, you just need to get through it. And there's always going to be something someone else is going through that's probably worse than what you're going through. So I can't stress that enough. It's just don't sweat the little stuff and just take every day because it is a gift.
For me, in many ways, cancer was a blessing, and I've heard other people say that as well. And because of what Pam just said, it also puts things in greater perspective. You just learn to appreciate everything, your family. It's not to say I don't still have anxiety over things I shouldn't, but it's just really put my life in perspective.
I feel the same way. I feel like I have less fear now. Before my diagnosis, I was fearful of everything, and now I'm sitting up here in front of all of you guys. So. Another thing I think that I've learned through my diagnosis is that I just want to be a face for young women and be an advocate, just to let everyone know that you have to be an advocate for yourself. You need to know your own body, you need to be aware of your own body, and just to know that you can get through it.
I stop to smell the roses a lot more often. And sometimes when I'm doing my hair in the morning and I'm upset, I go, Abby, really? You're not having a bad hair day.
Thank you, guys. So the bottom line is take control of your health and wellness, know your body, know your family history for those 5 to 10% who do have genetic clusters of cancer. Talk to your doctor about that. You may need to see a geneticist to look at genetic causes for cancer. Make sure to keep up to date with your cancer screening. And then we're going to we all decided that we wanted to touch on lifestyle changes because we know you guys are right at that time in your life where you're going to make long-lasting choices. And these habits that you're going to start now will carry you on throughout your life. So we wanted to touch a little bit on that as well. And then we'll wrap it up for questions. So this is one of my favorite books in regards to lifestyle issues with cancer. And it's a doctor who has had a brain tumor, and he wrote the book on kind of the whole aspects of health and wellness, and not only the emotional aspects, but also the diet nutrition aspects. So it's a good book if you've had cancer, but also just a good book about wellness. And what he really talks about is that there's a cancer seed, and there's also the soil that helps to make that seed grow. And we talk about inflammation and the immune system, and we talk about the things that we talked about at the very beginning: genetics, immunity, and inflammation, all the things that can predispose to getting cancer. And so his book really focuses on how can we reduce those things. And these are well documented maneuvers to help in these areas. So a Mediterranean lifestyle, and what does that mean? I mean, that means high fruits and vegetables, high fiber diet. So that means no, white flours, like all the processed foods that are available now. It means whole grain spaghetti, whole grain bread, minimizing sugar, focusing on the good fats like olive oil and canola oil and flaxseed oil rather than vegetable oil. It means increasing our omega-3 fatty acids in our diet through those healthy types of oils, and then also through ways like salmon and grass-fed beef. My favorite book on food is Michael Pollan's Food Rules. Have any of you guys read that book? Oh, it's a really easy read. It'll take you, couple hours to read it. It's a great book about diet nutrition, so please read that book. The other inflammation reducers and immune enhancers is laughter and joy, and this is a laughter yoga session that is at something called the Gilda's Club, and the Gilda's Club is made for people who are suffering through cancer and its treatment. And they have laughter yoga, and that improves the immune system and decreases inflammation. So find time in your life to meditate and to find humor, whether it be through yoga, through spirituality, or through your spiritual journey with church. But this helps your health. Another inflammation reducer and immune enhancer is exercise. So greater than 150 minutes a week will help to decrease inflammation and improve your immune system. Obviously, all the chemicals and pollutants in our world can increase inflammation. So a clean, anti-chemical world would be ideal, but we know that that's not possible. But things like airing out your dry cleaning after you've had it into the fresh air for a day, trying to reduce the amount of parabens that you use in your makeup and shampoos, that will help. So those are all kind of outlined in that book. Really accepting yourself for who you are and not trying to live a life that you're not wanting to live, that actually helps your immune system. And then surrounding yourself with family and friends, and that also is an immune booster. So it's important to have a community of friends that you will be around for your lifetime. And I think these women, part of their success is that they found a community of people that can help them through this. So that's all I have. We'll open it up for questions. Any questions?
You all said you're on tamoxifen, right? Am I saying that right? Tamoxifen. Yeah. Can you just explain that a little bit? I mean, I have a general idea of what it does, but.
So tamoxifen is a selective estrogen blocker, and it blocks estrogen on the breast tissue, but it's pro-estrogen on other tissues. And so we know that some breast tumors, or most breast tumors, are fed by estrogen and progesterone, so that helps to block that. There's other hormone blockers too that after you're past menopause, then we would recommend other hormone blockers, but these just happen to be young women. Any other questions? Yeah.
So during your treatment, over the course of your treatment, was there one point where you needed the most support? And then what point did you feel like you were kind of on top of the world during your treatment?
I think right in the beginning and then right towards the end. Because in the beginning, the fear of the unknown and what was actually gonna, happen, and oh my gosh, I have to go get chemo. And then the end, I was somewhat happy, but then I was somewhat scared because then I wasn't like doing something to actively kill that cancer. So then my anxiety level went up, and then I just, am I doing everything possible? So I would say the beginning and the end.
Anybody else?
Well, heck, I like the support the whole time. I don't know about you. But definitely, as Abby said, when you first hear the words, you have cancer, you need that support. You need that reassurance. And definitely at the end, I think we can all agree, when you stop and going to the doctor every few weeks, you need to find that new normal and how to get through life. So I would agree totally with Abby. And right away, a diagnosis, and then at the end, because we're not seeing a doctor all the time, and there is that fear of reoccurrence, and every pain that we have isn't the cancer going back. So I think you just need to just put your faith in God, and just, like I said, live one day at a time, and just wait for the next appointment and enjoy life.
I think going through chemo, it starts out kind of easier and then it gets tougher. And I think for me, just like the days that I'd get chemo and then 2 days later, I'd start feeling really sick and just kind of down. And I think in that time it was nice to get meals, 2 days after, and then 'cause it'd take probably 3-4 days before you're feeling good again.